Yeah, I'm pumped up. I'm excited about the message that we're going to share in this Nursing Outside the Box show because it's so needed. You know, we talk to nurses each and every day who are just lacking the balance, they're lacking the sense of purpose, and the flexibility is missing. And so they're just oftentimes, at a point where they're not really sure what they want, but they're confident that they don't want what they got. And they're looking for some ideas, some encouragement, some hope that there's something else out there that can help them to find the balance, purpose, and flexibility that they so desire. Donnie, talk to them just in case they're just joining us for the first time. Welcome, all of you. I'm David Bush. This is Donnie Alvarenga. We're the host of the Nursing Outside the Box show, and we're also certified health coaches and business coaches. We coach nurses and other healthcare professionals to become certified health coaches, and we're glad that you're here at our show. We're going to be talking about some outside-the-box thinking, and we're going to be sharing some strategies and tactics that can help you personally to improve your overall health and well-being, but also open up your mind to the potential that you have inside of you. Donnie, share with everybody just a quick overview of your story, just in case this is the first time that they've joined us.
Yeah, well, I actually was an oncology nurse first for about 8 years. And during that time, I quickly learned that as much as I could help people as a nurse, my job was just to get them healthy enough so they could leave the hospital. And healthy enough was just never quite healthy enough for me. And I was trying to figure out how I could help people be healthy. And in the process of figuring that out, I decided to become a pediatric nurse practitioner, which I did for 6 years. Once again, I absolutely loved it. I loved the people I worked with. I loved my patients. I loved being a nurse practitioner. I loved being a nurse. However, once again, I felt like there was something missing. You were talking about how nurses, they're looking for something and they're not quite sure exactly what it is. And I wasn't quite sure exactly how to get what I wanted, but what I knew is I wanted to have more flexibility. I wanted to help more, I wanted to be able to own my time. I didn't want to ask for permission for time off. I wanted to help my patients be healthy and not just healthy enough. I wanted to feel like I was more than a nurse. As much as I loved being a nurse, I loved being a mom, and I loved being a daughter, and I loved being a friend. And sometimes I felt like my life was defined by my career title. And so I wanted that balance. And so I knew what I was looking for. I just didn't know how to do it within this healthcare box. I actually even considered for a while leaving nursing altogether. And it just turns out that health coaching fell on my lap. I had never heard of health coaching. I had never thought of running my own business. These are things that were very foreign to my world. But because I kind of knew what I was looking for, that flexibility, the purpose, and the balance, all of those things came together for me when I started being able to help other people be healthy. And the way that I started was by taking care of myself. As a nurse practitioner, I ran a weight management program for kids, and I thought I had arrived in terms of my own health journey because I had struggled with my weight my whole life. But as I was doing that, I got pregnant with twins. And after I popped those babies out, I gained about 50 pounds in about 9 months. And so the whole idea of I knew what to do, but I wasn't doing what I knew. And I was thinking, okay, oh my goodness, so if I know what to do and I'm not doing what I know, first of all, how am I going to get back to that? And second of all, how can I help other people? And that's when I got introduced to the concept of health coaching. I started working with a health coach, and it was just amazing how she created this bridge from knowing what to do to doing what I knew. Not only was she this accountability and support person, but she plugged me in with this simple system that was so comprehensive and so deep, but so hard to explain. And yet I was able to lose those 50 pounds so that now I knew how to help other people. And what I had been looking for in my 16 years of nursing, I finally found. And so as I started helping other people, what I found is that I could actually make a living helping people be healthy. And so I've been, actually April 1st was my 6-year anniversary, and I've been home with my kids health coaching full time for about 5 of those 6 years. And so since I had never heard of health coaching before, I'm really excited to share it with other nurses that are looking for maybe what I was looking for, flexibility, purpose, balance. There may be other things that nurses are looking for. And what we've created Nursing Outside the Box to be is to really help nurses step outside the box of what they think is expected, of what they think is kosher, the word is missing me here, but what they think is normal. to really achieve what it is that they want, whatever that is in their life.
Yeah. Well, you've got such an amazing story, and it just inspires all of us every time we get a chance to hear that you've gotten on track with what it is that you really felt was your calling and your purpose in life. And that was to be home with your kids and to also continue to help others and to continue to be a nurse, but on your own terms. For other nurses that are watching us today, is that maybe they're at a point where they're not really upset with their career, but they're lacking something. They're lacking maybe physical well-being, or maybe there's a lack of peace of mind, or maybe there's just this goal in life that they just feel like they'd like to achieve it. Maybe it's an educational goal, or maybe it's a career goal. They'd like to open up their own practice or something of that nature. And we want to come along, all of you, and support you. As a business coach, I get the opportunity to be able to coach nurses every day to be able to pursue their passions, pursue their dreams, and to grow personally and professionally. So this Nursing Outside the Box show is going to be all about you, helping you to get healthier physically, healthier mentally, and healthier vocationally, which oftentimes increases your financial opportunities as well. So today our show is going to be all around the nursing empowerment tool that Donnie is so eloquently crafted in our blog. If you want to go check that out, visit nursingoutsidethebox.com and check out the blog, because she did a wonderful job in just breaking it down. And today we're just going to summarize it, and I'm going to have Donnie kick things off and just make the quick introduction to the connection between helping a person to create a healthier and more purpose-driven life back to the idea of the nursing model.
Yeah. So, one of the things that we are familiar with is the nursing process. You were talking about, David, how sometimes as nurses, we're looking for something, we're just not quite sure what it is. And when I used to think, I remember when I was in nursing school, I used to think, how in the world do the nurses know what to do all day? They come in, does somebody tell them, what they need to do? And that's not the way it works. You walk in, and yes, there's different tasks, maybe you need to do a dressing change, you need to give a medication, but we kind of decide the things we need to do by evaluating, by walking ourselves through the nursing process. We assess our patients, and then we diagnose what the problem is, and then we create a plan, and then we implement that plan, and then we evaluate. And so as I was thinking about that nursing process, I thought how powerful it would be if we actually applied that to our own life. It creates a framework for us to evaluate, what is it that we're looking for? A lot of times we feel like, oh, I'm looking for something. We can't put our finger on it. So it's like you walking in on a patient, you're saying, I could tell this patient needs something, but I can't put my finger on it. We start with the assessment. And so we need to if we apply that to our own lives, we can figure out what it is that we need to do and how we can get to where we want to go. So I think that the nursing process is the perfect tool for us to remake our career, remake our life, really.
Well, there are many nurses that are watching this right now and go, that's great and all, and I love to be able to sit back, but it just seems so complicated. It seems so complicated to think about the chaos that's maybe happening in my life, and to think that I could actually assess my own personal strategies or my own personal well-being and be able to go through that process on my own. What would you tell that nurse that's maybe just a little overwhelmed with life right now? Maybe the seasons of life have kind of dealt them a blow, whether it be relationally or vocationally. They have a bad boss. They have struggling health. Maybe they have some major health issues that are causing them significant pain, or they're having to take medication. And the idea of actually going through a process just kind of overwhelms them. What would be that encouragement you would share?
Well, when I started working as a nurse practitioner, the way that I would write my notes is I had to dictate it on a phone, and I actually just had a cheat sheet that I followed along. I knew how to do a head-to-toe assessment, but to dictate that into a very quick format, I needed that little cheat sheet where I went down HENT, cardiovascular, respiratory, clear. In all of 30 seconds, 10 seconds, I was able to say what I did in about 5 minutes, right? Or 3 minutes. But having a cheat sheet or having a framework takes away a little bit of that overwhelm. And so another thing that I remember from nursing school, oh my goodness, the nerves. On old Olympus towering top, a fin and fiddle viewed a hop. Why do I remember this? Why is it stuck in there? Well, because it provided me a framework to go through all of the 12 cranial nerves so that I know how to assess it. And so if I walked in on a patient, I'm like, how do I know what is wrong with them? Why is their face drooping? You know? And so when it comes to our life, if we have a framework to follow, it actually makes it a lot easier to take away that overwhelm. And, you know, we actually have an assessment that we use that offers people a framework so that they can evaluate how are they doing right now, because that's the first tool. The first step, right, is the assessment process. Now, I do have to back myself up because the assessment is only as valuable as you understanding what the ideal is, okay? So when I say, why is somebody's face drooping? I know that that's a problem because normally it's not supposed to be drooping. And I know that there's a standard in my head that says their face is not supposed to be drooping. Why is it drooping? So when we look at our lives, the nursing process does start with the assessment piece. But actually, before you get into the assessment, we have to define the standard. And that's where I think nurses sometimes miss it. Because we had a lot of control when we were in high school and we decided, I want to be a nurse. I'm curious to find out, why did nurses decide to become a nurse? Why did you pick that profession? What did you hope for with that? There was a lot of control in there, right? Here we were in creative mode. I decided I want to be a nurse and I went to school and I paid and I got into it. Now, after you become a nurse, now we get into what you were talking about, life happening. So now we have responsibilities. We have maybe student loans to pay. We have a mortgage to pay. And we get caught up in the do, and we forget, why did I start? We don't get into that last step of the nursing process, which is evaluation, right? But really what we need to start with is the standard. What is the life that you're looking to create? Taking some time, I mean, even if it's 15 minutes before you go to bed, to really kind of evaluate, what is the life that I want to live? If I had control over it, what would it look like? And we talked about this a little bit last week, didn't we?
Yeah, I definitely would encourage everybody to go back into the previous episode that we recorded last week, because it'll tell you a little bit more. It'll give you some tips and tools and how you can begin to really clarify what your be, do, and have, or your desired outcome is, which really helps you to set the standard. And, you know, this is the opportunity where, you know, a lot of nurses struggle with the desire to dream, because, you know, when life happens, maybe there's some things that you've given up on. And this is really given, or we want to give you the encouragement to think and to dream and to go outside the box. Don't be confined by your current reality. Don't be confined by the symptoms or issues that you may be facing in your current circumstances. Dream of what a desired outcome could be or should be in your mind, and then begin to evaluate where you stand in relationship to that. And that previous episode will give you some more tips. But Donnie, let's keep moving along and talk a little bit more about, once they have done the evaluation or the assessment of where they want to go and where they're at today, talk about the diagnosis and begin to identify some areas of improvement, and then how they can implement a plan to start moving forward in all aspects of well-being.
So the diagnosis part is where we analyze what we've assessed, right? And that analysis compares the existing reality with the standard. And so in that diagnosis, a couple of diagnosis codes or diagnosis statements that nurses could use is ineffectual relationships, right? Maybe people are struggling with their relationships because they don't have time for them. And is that something that bothers you? And sometimes without this framework, we can miss that. We can miss the fact that what's bothering our relationship is maybe the environment that we're in. And, you know, within healthcare, we're programmed into a reactive mode. You know, we're trying to fix the problem but put them in the hospital. And so in us trying to apply the nursing process to our own life and career, we do have to have a little bit of a paradigm shift where we're back in college, where we're deciding where we want to go versus just reacting to our circumstances. And so, but creating that list of diagnoses of what is it now compared to that standard, what are the things that I need to work on? So is it a relationship? Is it that I want more time with my kids? Is it that I want to take better care of myself physically? Okay. And creating this list of I don't want to say problems, but areas that need improvement, that we want to improve, that's that diagnosis phase. And then once we've diagnosed the problem, now we know the next step. And a lot of times when we're in that reactive mode, we react without defining the problem, and therefore we never fix the problem. And so in that planning phase, that's where we set our goals. And one of the things that we do as nurses for our clients, for our patients, is we set a goal that's in the client's best interest. We do not take into consideration how comfortable it's going to be for them. So somebody that just got out of surgery doesn't want to get out of bed. They don't want to get out of bed. They're in pain. And yet we know they need to get out of bed. So we set these goals and we set these plans in motion independent of how they feel about it. And if we were to apply that to our own lives and decide our goals and what it is that we want based on that standard we had set, without allowing our fears, without allowing our what we think we can and we can't do, if we just took that out of the picture and said, this is what needs to be done to get there, it's amazing the things that we would get done.
Yeah, I love the quote that I saw the other day, is that it's not who we think we are that's the problem. It's who we think we are not that's the problem. And oftentimes it needs an outside perspective. And so we would love for you to comment or to go over to the Nursing Outside the Box website and just let us know that you're interested in taking life, health, relationships, or career to the next level. And we would love to be able to come alongside of you. We've got a free report with 77 different ways to do nursing outside the box that could just be a great way to start getting your brain into the mindset that there's other things out there that maybe could be more designed towards your gifts, your talents, your skills, and maybe the purpose that you'd like to live out in your life. You know, they say that the average person in America dies at the age of 40. They just don't bury him into the age of 80. And, you know, it's a Les Brown quote, and it's got a little bit of jest to it, but it's really the reality that most of us, as we get older, our dreams start to slowly fade away. Because, you know, if we didn't accomplish them in our first 40 years of life, what's the chances that we're going to do it in the second half of life? But nothing could be further from the truth. I mean, you live in the land of opportunity where everywhere you turn, there's the potential to create opportunities. And you're not constricted by the government. You're not constricted by anything other than your own personal mindset and what you think is possible. So what Donnie and I do in our coaching is oftentimes we encourage people to focus on what you can do. Right now, your plan may be very simple. Can you control what you eat? Maybe with some assistance, you could have a very simple plan that says, you know what, this is what I'm going to eat for a week. And maybe that can begin the habit building process to start awakening you to other areas of your life that could maybe be improved. You may not know how to start your business. You may want to be an entrepreneur, or you may want to be in practice by yourself, but you're not really sure even where to start. And maybe you've dreamed up this idea of being in preventative care or wellness, and you don't even know what the next step is. This is where some outside perspectives from some people that have done it can help you to develop your plan, or they could actually give you a plan, which is what helped me 8 years ago when I lost 100 pounds, is that somebody gave me a plan and it didn't require a lot of complexity. All I had to do is just simply follow the plan. And sometimes we need that, Donnie. We just need a simple guide that says, here's what to do next. And if you do it, you'll start seeing results, and then you'll be awakened to the full potential within you.
Well, you know, I think that you just hit the nail on the head, David, because in this implementation phase, I just used the example of getting a patient out of bed. But you used another example, which is the food I eat. And guess what nurses struggle with a lot is eating, because number one, they don't have time. And then when they do have time, they either have drug reps pushing food in their face or patients bringing them food. And so how much control do we have over the things that we eat? But having somebody hold us accountable makes any situation a little bit easier. Everything is so much easier and a lot more fun together. And so this implementation phase it's crucial that we have somebody hold us accountable if we want to be successful.
Yeah, and if you need some intervention and to help you to take your implementation to the next level, we would love to come alongside of you. And if you already have a mentor or a coach or somebody that you're seeking advice from, you know, reach out to them. We like to be able to partner with people because we believe in the concept of if we help other people to get what they want, we'll get what we want. And what we're looking for is for nurses who would like to emerge themselves into the wellness-based industry. This emerging specialty is exploding with opportunity, and we'd love to partner with people that want to get outside the box but want to do it maybe gradually. Or if they want to do it on the fast track, we'd love to partner with those people as well. But most of the people we partner with are just looking for more balance, flexibility, and purpose. And we give that to them in all different types of doses. Donnie, wrap us up today and talk a little bit more about next steps and how people can take this nursing process and really take action with it here in the next week or so.
Well, one thing I don't want to forget to talk about is the evaluation. Going back now that we've assessed, we've diagnosed, we've planned, we've implemented, now we've got to evaluate. Did I get what I wanted? And so I might start with that right now. Ask yourself, when I went to nursing school, why did I go? And did I get what I wanted? And then go from there to start creating that whole process. But as you start figuring out and as you start remembering how to live, like my girls were listening to in the car, how to be alive, remembering how to be alive. I found that a very, very powerful thing is to change what goes on between the ears. It's like you were saying, it's not so much what we think what was it that you said? You said
it's not what we think of ourselves. It's the problem. It's not who we think we are that's the problem. It's who we think we are not that's the problem.
The bottom line is that it begins and ends between the ears. It begins and ends. Whatever success we find in our life in any area, it begins and ends there. And so we've got to start there. And, we actually just started a group on Nursing Outside the Box. For those that are not members of our Nursing Outside the Box community, we invite you to join us. And we just started a book club. We call it the Big Thinkers Club because we know that it starts between the ears. And so we're actually reading Tony Robbins' Reawaken the Giant Within. And so whatever it is that you have forgotten to dream, whatever dream has been put on hold, maybe we need to just wake up that giant that's sleeping inside of us. And we would invite everybody to join both Nursing Outside the Box, the Facebook group, and join our reading club, our book club. That's entirely virtual, to start changing those thought processes so that we can start creating the life that we want.
That's great. Well, I'm excited to partner with you, Donnie, in helping more nurses to get outside the box of not only just the traditional healthcare world, but to also get out of their own comfort zone so that they begin to stretch themselves and they see this tremendous potential that's awaiting them outside of the box in this fun world we like to call the land of opportunity. So thanks so much for joining me, Donnie. Thanks everybody for watching. If you liked what you heard, we'd love for you to share it or maybe invite other people to watch it. And let us get the word out that there's more opportunity out there for everybody who wants it.
Yep, and we'll be back next week. We'd love to answer your questions live as we're talking.
All right, see you guys here next week, next Wednesday at 1 p.m. Central, 2 p.m. Eastern.
Bye.